Have you ever wanted whiter or brighter teeth? Well, let me tell you about dental veneers that can help accomplish that. What a dental veneer is a thin sheet of porcelain that is bonded to the front of the tooth. There is some minimal preparation that needs to take place, but with that, we're able to keep most of the structure of the tooth itself and change just the shade, also the shape and size of the front of the tooth. And veneers can work very well to enhance and change your smile to that whiter and brighter smile you've always wanted. Do they ever fall off? Well, unfortunately, I have to say yes, occasionally they fall off. But if they do fall off, they're very easy to put back on. Are they uncomfortable to have done? The least comfortable part of that would be to get your mouth numb. You do need to get numb to get a porcelain veneer done, but once we get past that, it's a pretty comfortable situation. We do minimal preparation on the tooth, then we make temporaries for you, and then 2 to 3 weeks later you come back for the permanent veneers and we trade out the temporaries for the permanent ones. Sometimes we get patients that come in and say, I want non-prep veneers. That was a big thing that one particular lab was promoting, and you saw it on TV and you saw a lot of changes. The difficult thing about that is if you start with misshapen teeth, non-prep veneers are very difficult to make the teeth look normal again. So sometimes we have to prepare the teeth, shape them so that we can get a better final result. I recently had a patient that insisted on non-prep veneers. We did the mock-up for them. We typically will get the lab to wax up what the veneers are going to look like at the end. But the bottom line was that we couldn't find a lab that would agree to do non-prep veneers because they realized they weren't going to turn out right. So we discussed it with the patient, told them what the laboratories had said, and we prepped the teeth for the veneers, and I have no regrets doing that because things looked great. With veneers, we hope that they're going to last a lifetime, but it's different for every individual, and a lot of that has to do with how well they take care of all their teeth. So one of the things that we do is once we place veneers, we talk about how they take care of them, how they keep them from falling apart or staining or having problems within. But again, like we have talked about in various other videos, we want to make sure that we see you periodically every 6 months so that we can stay on top of this stuff. If we see something, a margin where the veneer hits the tooth opening up or not being as closed as it was, then we can get in very easily and repair it and make sure that there's not any problems. Long term, they continue to look good. However, you got to keep in mind that your mouth is going to change. It may be that you show more tooth 20 years down the road, but for the most part, the veneers look good and continue to look good. You may have questions about this video. If you do, please leave a comment. We want to make sure that you get all the answers that you need. We want to make sure that we inform before we perform. And like I said before, don't wait until it hurts.